Greetings, and welcome to the Hospital Association of Southern California's podcast series, where we speak with our endorsed business partners. HASC's endorsed business partners are trusted companies offering high-quality services and products designed to help our hospital members provide the best care possible for their patients. I'm Adam Blackstone, Senior Vice President of Communications with HASC. In today's episode, we'll hear about HASC's newest endorsed business partner, Cedar. Cedar is an enterprise financial engagement platform that improves the end-to-end journey for consumers. Cedar's solution increases patient engagement and streamlines their payment process, helping healthcare organizations increase payments, boost operational efficiency, and improve patient satisfaction. With us today is Seth Cohen, President of Cedar. Welcome, Seth, and thanks for joining us today.
Thanks, Adam. Great to be here.
Cedar is a relatively new company, having launched in 2016. Can you please tell us more about why and how Cedar began?
Yeah. So Cedar began from a personal story. So my colleague, Florian, who's the CEO and co-founder of Cedar, came up with the idea based on a personal medical experience that he had with his wife. His wife had to go to the emergency room, and while she was okay, very fortunately, the aftermath of that was very challenging because they were kind of immersed in a set of bills that were confusing, difficult to understand, difficult to pay. Frankly, many of us have had this experience. I find when I talk about what I do, I'm inevitably cornered by a family member or a friend saying, "Oh my gosh, let me tell you about this awful billing experience I once had in healthcare." And so the mission here, the genesis of the company is very, very personal in that the challenge of the billing experience has been so significant. And what's interesting is that as we reflect on, the amazing care that we receive at hospitals and health systems across the country, the quality of care and the quality of the experience when we're within the four walls of those organizations is outstanding. And most patients are very, very grateful for the care they receive. But when you walk out of that building and then you're in that mode of recovery where you're really vulnerable and you're healing, that aftercare experience can be really challenging. And that's what Cedar is founded on, is how do we modernize and simplify that billing experience when you walk out of the building so that it really matches the level of quality of the care you receive when you're in it.
Thanks, Seth. And what are some of the biggest challenges for patients in managing their own healthcare payments? And how do these hurdles cause financial headaches for care providers?
Yeah, I don't know how long you have for me to answer that question, but we can be here all day. I think there's a number of things. First, and I think most importantly, is the consumer financial burden has grown significantly over the last few years. If you look at the stats, I think the fastest growing health plan that consumers are opting into or employers are opting into is a high deductible plan. And I think about a third of all patients in this country are exposed to a high deductible plan. And so this is really critical, right? I mean, 10 years ago, if I went to a hospital or a consumer and said, "We're fixing medical bills," I don't think that the patient experience of it would be that critical because most of us were paying co-pays at checkout. But now many of us have $3,000, $4,000 deductibles. And that's a very significant financial obligation. And in healthcare, unlike other parts of our world, no consumer ever budgets for a healthcare expense, right? Pretty much all healthcare is unexpected expense. And so if you're an average American with an unexpected bill of $3,000 to $4,000, that's a really, really big deal. And it's a big deal for consumers. It creates a ton of stress for them. Healthcare is the largest driver of financial bankruptcy for consumers in this country. But it's also a really big deal for hospitals and health systems because now they're chasing patients for significant amounts of money. And it's a very challenging and very expensive process.
Well, the process you described can definitely be overwhelming for the average consumer and resource intensive for providers as well. How can Cedar further benefit HASC member hospitals and help them better achieve their mission?
Well, this is a great opportunity for me to plug that I am native to Southern California. I was born in Los Angeles. I currently live here. And so I am very thrilled to be working with this organization and eager to engage more with member hospitals here. So just delighted from a geography perspective. But I think that there's a lot of commonality in the mission that we have and the mission of your member hospitals. At Cedar, our mission is to make healthcare more affordable and accessible. Right. And we do so by partnering with forward-thinking health systems that are really committed to the patient experience. We talk to so many organizations like your member hospitals who acknowledge that a big part of their mission is advancing the quality of patient care, and affordability is a big part of that. If a patient cannot afford care and chooses not to get care because they're worried it's expensive, or gets care, but then is very, very anxious about how to pay for it, those are barriers to quality care that I think all of your member organizations, think about as a priority. And so we're really excited to work together to support and advance missions by improving that affordability and accessibility. Also, it's a great moment to mention that we do work with one of your members today, the Keck Medicine of USC system. They've been a partner with us for a while now. And I'm delighted to share that the impact we've had with that member organization has been extraordinary.
Well, we're coming to the conclusion of our time together, but I'd like to ask if there are any last thoughts you'd like to share with our HASC member hospitals.
Oh gosh, I could go on all day, but I think that's it. Again, I think the most important thing is we're really excited about what we're doing. We think we're frankly one of the few companies really dedicated to a digital, modern, kind of payer-connected approach to solving this really big patient billing challenge. And we're just excited to share more again about our learnings and best practices with your community, and hope to have the chance to do so.
Well, Seth, I really appreciate you taking the time today to provide our members with more insight and information about the valuable services Cedar provides. We look forward to hearing more, and I know our members do as well, so thank you.